Hi guys, my name is Robbie Holmes with Bodybuilding and Personal Training. Today I want to talk to you about different methods and techniques into injury prevention and mobility issues you may have with your hip and your glute area. As most people use stretching as their form of injury prevention or cool down techniques, I'm going to show you it's becoming more common anyway, a technique called self-myofascial release or trigger point shooting. And what we're trying to do here is just release really localized spots within the body that are really giving us some pain and aggravation. What I'm going to use today to help me is just a really hard ball here. You can use anything from a tennis ball to a lacrosse ball in order to kind of help you out with these types of techniques. The first muscle area we're going to try to work on is the piriformis muscle, which is just outside on the outside edge of the glute, and it tends to be really tight and inflamed. It gives us a lot of irritation and mobility issues. So what we're going to try to do here is just take the ball, tuck it underneath. We're going to just try to rest the outside edge of the glute and our body weight on top of that ball. And once you find that spot, it'll be very uncomfortable, but I want you to try to hold this out for about 30 seconds to a minute. It's important that you give at least 30 seconds to allow your body to help release it. Similar to a massage therapist, the muscle needs some time to help release that tension, that binding that could be in that spot that we're working on. And again, 30 seconds to a minute in that area. The next spot we're going to kind of work on, and this time I'm going to just try to use a rolling device. And in this case, we're going to do your IT band, which is just a band of tissue down the outside edge of your thigh, basically running from the hip to the knee. And what we're going to do here is just take the roller, start it down by the knee, get onto our side, outside edge of the thigh. We're going to slowly rock and shift our way up the outside edge of the thigh, all the way up to the hip. I'm going kind of speeding it up for you, but by the end of that 30 seconds to a minute, you've made your all the way, you've made one pass through from the knee to the hip. And again, 30 seconds to a minute on both sides of that area. Along with the IT band would be the actual thigh muscle, the quad itself. And we would use the exact same method. Get down. This time, the only difference is we're going to be more square to the floor. But again, rest that thigh on top of the roller. Start just above the knee and slowly rock and shift your way up towards the hip area. Again, spending 30 seconds to a minute on that each side. That would be the trigger points or the self-myofascial release work, but also I'll show you a few stretches that tend to be good as well. The first one is pretty common. We're just going to lay flat on the floor with the legs bent. Bring one leg up, cross it over, and have that knee externally rotate out. If you wanted to give yourself a little bit more of a stretch to the outside of this glute, I'm just going to rest my hand inside of the knee and apply a little bit of pressure on the outside. But it's very important that I keep both hips, the opposite hip, the left hip in this case, both down on the floor. We don't want to rotate the hips up just to get more pressure in this, or more stretch in this glute. Again, 30 seconds to a minute with the static stretches is beneficial. One other stretch I'll show you here is what I call a 90 to 90 stretch. So we're just going to kind of sit upright. We're going to bend one leg 90 degrees in front of us and the other leg 90 degrees behind us. And depending on how flexible or tight you are in the hip and the glute area, will allow you to kind of drop forward over top of that leg. You can come across more either way, but depending again how tight or flexible you are, you're just going to try to shift and in a sense drop your upper half, your upper body over top of that leg. And again, trying to find that range where you can hold for at least 30 seconds to a minute. It's important that you hold for at least 30 seconds. Anything less than that, the body doesn't really have much time to kind of get a beneficial stretch from a shorter period of time. Other than that, that's pretty much it. You have